Hey, Hillary. I
Hi.
think that one of our biggest issues we talk to women about is hormone changes in middle life and what's going on with them. And I think something that we miss is that we think all these hormones are related to, problem sleeping and maybe anxiety and sweats and things like that, drier skin. But actually, it's our brains and memory. So I think that's the biggest thing that is missing in our society is like if you're walking around and you forget a word and you're in your 40s, it's probably estrogen going low.
Estrogen's having its heyday, which is amazing. You can't get online without hearing people screaming from the rooftops that they need estrogen. So that's the good news.
Yeah.
But women, it's still kind of getting women the care and the health that they need and trying to understand and explain why. Many people who come to natural doctors or are interested in natural medicine still might have this thing about, are hormones safe? Are hormones good for me? And it's totally a normal, great question. But
Mhm.
what we know is that estrogen is one of the things that help protect and keep our brain healthy, and potentially lower the reduction of dementia and Alzheimer's. There's a
Mhm.
couple of reasons why I think it's really, really important. We're both huge hormone advocates. I am prescribing hormones every day, um,
Mhm.
patients, and it is amazing to see the difference in brain health. So Kara was right. If you're having lapses in memory, word finding issues, a lot of times it's because there's a shift of estrogen on your brain. It works directly in helping memory and memory function. And estrogen is a therapy that women should be using often in their late 40s, going into, and sometimes earlier, like if you've had a lot of chronic stress and you're missing your period, it's really important to go through. And I think it's really interesting. One of the things that we see when after you have a baby, many
Mhm.
women can relate to how their brain feels after they have a baby, right? Like after you have a baby, you can't remember shit. You can't remember your name. You don't know where you are. You can't order anything. It's called pregnancy brain, or like breastfeeding brain. I had a baby in med school, right? And like literally showing up for clinic was like so embarrassing. I used to be so smart and I was like, "Bah, bah, 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 bah." I could count on this sharp brain of mine. And I literally was like, I didn't know what room I was supposed to be. I was literally like so far behind. And
Yeah.
that's because you go from having a massive amount of estrogen during your final months of pregnancy, and then boom, you're having a major hormone shift. So if you can't really relate it to perimenopause, remember what happened after your babies. And it takes a while to get your brain function back. That's what's happening in your late 40s and 50s. Just it might be happening more subtly because the shift isn't that dramatic. But women are walking into the kitchen, not remembering why they're there, can't remember where the keys are. I have a good friend. She's wearing a purple shirt today. She has a really hard time remembering where her phone is, or finding her phone, or finding,
I
things.
didn't.
This is a thing that happens. And
Yeah.
women come in all the time saying, I have ADD or I have memory problems. It's
Mhm.
estrogen.
It is. And it's not talked about enough, right? It's not that, oh, you're getting old, I can't remember anything, but it's actually that your hormones aren't at the proper level for your brain. Like the actual effect of estrogen on your brain is not a thing that we think about. You know what I mean? Like we just don't think about it. And it's so important. I remember that picture we saw of the neurons and what it looks like when estrogen is at a proper level and what it looks like without them, the actual neurons shape changes, the firing changes, everything actually changes. So I think we think like estrogen's for ovaries or like somehow women health stuff, but it's really for your brain. So estrogen's an important hormone for your brain health, and that's what we're trying to have everybody really realize. And I think this whole brain kind of going toward dementia thing is scary for people because we've seen, grandparents and aunts and things like that. We've just seen such horror stories, and now we're in that sandwich generation, right? Where a lot of our friends are caring for these older parents who have some kind of dementia or Alzheimer's. It's like a really big deal for people. And one of the things that I was reading about, and they were talking about hormone replacement therapy, but I thought was such an interesting point was, what is the effect of this dementia and this lack of being sharp, as you say? What is the actual effect? I mean, it could be financial. You know how all these people are calling people and like, oh, just, your bank account was stolen. You have to confirm whatever.
I
And
just had
all
that
those
yesterday
scams.
on a hike. Her mom literally just got scammed driving to the bank
Oh,
here to withdraw money in Marin. Very sharp woman. Things declined quickly. Anyway, yeah,
yes,
it's a big
but it's
deal.
like the reason why we want to think about hormone replacement therapy or hormone detox pathways or actually having these things checked for us is that this could cost us, financially. It could have us make really poor decisions for our families, so it's bigger than just me not walking in a room and being like, where is my phone, which happens, on a regular basis. But that's sort of silly, right? I don't like really need my phone, right, Hillary? So the thing is, I do need my brain to be able to think through processes quickly, and I need to be able to identify a scam, and I need to be able to make decisions that, benefit me and my family. It's a really big deal to think about this, and I think it's overlooked, and I'm hoping that you're all hearing that. And hormone replacement is something to definitely have a conversation with your doctor about. It's a really important part of this. You're in your 40s, you're in your early 50s. What are you doing as far as the hormones go?
So the interesting thing about hormones is they act on every cell in our body. There are a ton of receptors for estrogen in your brain, period. And estrogen has a big effect on the way that our brains function and the way that we feel. So the brain is not only responsible just for memories, function, control, it also, like, our feelings and our emotional regulation is also happening in here. And so there's a few things. Women are twice as likely to have dementia and Alzheimer's than men. Okay, so this is impacting women at a massive scale. It's the fifth leading cause of death for women, dementia and brain related things. It's on the rise. And 1 in 5 women at the age of 65 gets diagnosed with dementia. This is like a really big deal.
Mhm.
The data early on with dementia and hormone replacement therapy was sort of mixed. And that's because back in the 2000s and the 90s, they were using non bioidentical hormones. They were using um,
Equine.
medroxyprogesterone and estrogen that was not estradiol or bioidentical. And the research was mixed because because these molecules were causing some inflammation. What the research is showing now is that if women are starting their hormone replacement therapy straight away, like basically we're not having a pause in our hormone decline. We're not having a menopause. We're not having a perimenopause. We're just having estrogen connected to our brain. Those women are having reduced anxiety, reduced depression. Both of those things are risk factors for dementia,
Mhm.
and less memory lapses. So I see it all the time in my clinical practice.
Mhm.
And I'd say that women start to have memory decline in their, like, around 46 or 47, unless you're in your earlier 40s and you've had a divorce, a death, a major loss, a major stress. You're going to start to experience these things sooner because your hormones really decline with big, huge stressors. Some women will go through early menopause after a major stress. So these are things that you don't want to let pass by you. The memory lapses that you're experiencing are contributing potentially to dementia. Does it mean if you're having memory changes in perimenopause, you're guaranteed to have dementia? It doesn't. But if we treat it so that your brain is just happier and estrogen is still part of your brain health, early, it's going to help reduce your likelihood of getting Alzheimer's and dementia.
And we know that the first symptom of perimenopause and these hormone shifts is actually memory issues. So it's not something we actually associate with hormones necessarily. It's memory issues. So you might see that age 45 or so, something like that. And that is actually your first sign that, ooh, these hormones are shifting. And then I want to ask you a question about this. So I think it's a newer concept to some people about, oh, but I'm still cycling. Why would I need to think about my hormones now? That's a really common conversation we have, right?
The really interesting thing is when you do a when you're looking at labs for
Mhm,
women, and you don't need lab work to be on hormones, or I just want to stop care access. Women should have access to hormones. So I just want you to get access to hormones.
mm,
If your doctor's not playing the hormone game, then find one who does. So, but when you look at labs of people who are cycling, Karen and I do a ton of labs for fertility women. Women in their ovulation, say like a 40-year-old woman that's still ovulating, she's
mhm.
going to, in her mid-cycle, typically get upwards of 300s or 400s of estrogen if you're checking a blood level of estradiol. Women in their 48, they could still be cycling, but they're at about like a third of that, or some are like a half. Like, so there, it's enough to keep the menstrual cycle going, but the hormone levels are like nowhere nearly as robust. And
That's so important.
and you'll see that where there can be cycling changes, like women can be like, I'm bleeding more. And that's a progesterone issue. So it comes down to balance. But just because you're bleeding a little more later in life doesn't mean you're chock full of estrogen. All these things are relative to each other. But in general, as the lights dim on the ovary and the ovary life is coming to its beautiful end, which is really early. And remember, women used to die in their 60s. Like, women weren't around. So if you stop ovulating in your late in your 40s or something, and you stop having babies, and then you die when you're 60, there's not that many years when you're like without hormone. But now women are living so long. Women are working until they're 75. I had a patient
Right.
yesterday that was 68. She's like, I'm looking to retire when I'm 75 or 78. I mean, if you're running your own business and you're 78 years old, you need to have your full brain function. No,
Absolutely do.
so
No.
estrogen is one of the massive major factors in dementia and prevention, keeping your brain full. We always say at Cultivate that estrogen is what is keeping you juicy, right? Like, I
Mhm,
always use that word, juicy. And what we see in women in fertility or in as they're aging is they get more dried up, and we're trying to get them juicy, juicy, juicier. And
mhm.
as the ovary stops working, estrogen goes down. Estrogen is the thing that makes us juicy. It's the thing that builds our lining. It's the thing that makes our boobs perky. It's the thing that makes our vagina wet. It makes our vagina juicy. I'm using these really crass terms because that's just what it does.
It does
In
do that,
in
yeah.
our brain, it's
Ultra.
doing the same thing. It's like hydrating the brain, and the brain wants to be full, hydrated, and like fatty. So when
Mhm,
we talk about diet, like I just did a smoothie, we're talking about using a lot of fats for it, but
mhm.
estrogen's having that same effect in the brain.
And we learned that in traditional Chinese medicine that the lack of estrogen or yin deficiency is dryness, right? It's dry. It's that's why the wet is what we want. We're going for moisture here. So it's a really important thing to think about that. Like, you can still be cycling, but your estrogen, which triggers ovulation, is much lower than it's been in your life. So it's very important to think about the hormone replacement before you're actually totally in menopause, and I think that's just a message that's not out there. So that's good to hear.
Yeah, and it's nuanced when you're working on hormones and estrogen in perimenopause. It's a lot more nuanced than when you're in menopause. It's much more straightforward. The nuances are that you don't want to overbleed, you don't want to overstimulate your breast tissue. It's a delicate shift, but if women are coming in and they're talking to us or talking about I'm having an issue with word finding, I'm okay, and then all of a sudden I can't like recall words. It's like you can't pull the card as fast, the brain's spinning slower, or you're coming in and you're like, I know I have ADD. I wasn't diagnosed early, but I know I have ADD. I mean, this is something that's
Maybe you don't.
maybe you don't. You
Maybe you
just
don't.
some estrogen. And there's
Right.
lots of ways to you don't need to go on full on hormone replacement therapy, but there's a lot of ways to support the brain so that you don't have this decline. And we want you sleeping well. We want you, like we said before, in a good positive mood. All these things have significantly impact that dementia situation. And
Mhm.
so July for us, it's like brain health month at Cultivate. We're on fire about it. We
We're
feel
talking.
super passionate about it. We
Mhm.
start in a few days about doing a brain health series. If you're not signed up for that, do that. It's all free. We just want you to have a lot of good tools and information for your brain health, because if you're going to be the matriarchy of your badass family
Mhm.
and in your life, you need a fully functioning brain.
You're
And
not
just
even who you are without your brain, right? It
is there
determines
some
personality and everything. It's
And if
important.
you're following us, if you're some of our devoted male followers, then testosterone is very similar for men. So we're speaking about estrogen today, but you could literally sub out testosterone in men. They just feel the effects a little bit later,
Mhm.
more like in the 50s than the women are experiencing a little bit earlier. Um, so much to do, and estrogen to prevent dementia, and estrogen is one of the main things that is should be part of everybody's treatment plan if you qualify for using estrogen and hormone replacement therapy.
So don't forget about estrogen if you're forgetting stuff.